She wants to do more exercise, and she has a lot of difficulties finding time to do so. No, not she, you. And you have a lot of difficulty finding time to do so. You'll be the patient, I'll be the provider today.
I try to cut down on my chocolate intake really.
You are trying very hard to lose some weight. So if you feel it's not correct, you correct, you can correct. So it doesn't have to be, you just make a guess what they think the patient. Because if the patient doesn't feel that, no, doctor, no, it's not just to lose weight, I just want to drop my diabetes, they'll correct it. So you correct, so you are inviting them to correct. Come, correct.
It's not about losing weight, it's just me to be healthy, eating a better, healthier choice.
You can't control yourself to take chocolates, but then at the same time it's not healthy for you.
Yeah, that's a good reflection.
Really, which one?
Doesn't matter, but that's a good reflection. Then, you?
Yeah, exactly. Because I think chocolate just gives me that sense of satisfaction when I eat it. It has almost become a habit to me. So I find it hard to stop eating.
Yeah. So just now you asked, right? So now you can see as the conversation progresses, it's changed already. Now you feel already. Can you see the words change already? I feel things like that. So okay. So you will reflect with this kind of same kind of evocation works also. So also you can use same like you feel that you get a lot of happiness from eating chocolates.
I feel like without chocolate I cannot survive because like there's nothing to look forward to in daily life because of all the stress.
So if you stop eating chocolates, you will become depressed. So I try to exaggerate, so it's amplified. Maybe you change something else. Eating chocolates bring you more than just the action of eating. You feel that there's a certain emotional significance or something else to it. Well, there must be some emotional connection between you and the chocolate. And then the patient, you say something, or you want to continue? Continue.
Yeah, sometimes I have a work stress and I have a lot of assignments, that's why I cannot cope, and that's why I need chocolates to help me to relieve my symptoms.
See, so now you found the reason, you see?
Yeah.
So you see how the conversation is progressing already now. So now you are getting some sort of reason already, So you want to evoke already, then you can start to evoke more and more already.
Get what you mean already.
So that is called motivation interviewing.
You out the missing point, right?
Yes, you want to fill out the blank, So the MI is like that, It's like my company logo. So you must go and join the dots. You must join that dot for the patient. So now that she already told you her reason. So okay, let's continue. So eating chocolate is not just food for you. It helps you de-stress and make you feel happy.
I can relieve my stress level.
Okay. So I summarize that. So after a while getting lost, you got to summarize. So okay, I summarize that chocolate is very important to you because it helps you de-stress, help you cope with life stresses. But at the same time, you know that eating too much of chocolate may not be a good idea because of your medical condition. So sometimes if the patient still want to continue on this topic, so be it. Sometimes they might want to talk about other things, right? So then you can talk about other things. So then if she say, oh yeah, she wants to consider other alternatives, then you say, okay, so there could be other alternatives to other than chocolates to distress. This one is a simple reflection, okay.